is Jessica Moscoso. I'm going to be talking to you about cirrhosis of the liver today. Cirrhosis is the 12th leading cause of death in the United States. First, I'll be going over what it is a little bit. I'll reviewing over the causes, and then lastly, the treatment of cirrhosis. Okay. So there's not necessarily a cure for cirrhosis, but there are lots of different treatment options out there. That's the number one thing that everybody should know. I'm currently a director at a multi-specialty surgical center, with gastroenterology being our main specialty. I've been in the field of gastroenterology for 8 years, 5 of those years as a nurse. Okay, cirrhosis is scarring of the liver. I have a picture here that I'll show you what it looks like. Okay, this is what a normal liver looks like. This is what a cirrhotic liver looks like. And it's located in the mid and right side of the upper part of your body. Okay, a liver should generally be soft and spongy, which I have a little of a demonstration here, where it's soft and spongy, whereas a cirrhotic liver, once again, is very hard and dense. I don't think anybody wants anything that looks like this inside their body. Scar tissue generally forms with cirrhosis of the liver, and that's what makes it dense, and blood flow can't get through. That's when you see patients where they look yellow, and that's jaundice. Different things that can cause cirrhosis of the liver is chronic hepatitis, such as hepatitis B, hepatitis C, certain medications, and then the number one reason is alcohol. Here are those things. You have medications, chronic hepatitis B and C, and alcohol. And it's not very comfortable. It's very painful, as this gentleman's experiencing here. Alright, now we've briefly discussed what it is. We'll go a little bit more in detail of the other causes. Besides the chronic hepatitis and the alcohol medications, there are some genetic disorders that can cause cirrhosis, such as hemochromatosis. That's a lot of iron in the blood, too much iron in the body, and that can cause cirrhosis. Some things you just can't quite avoid. It's not very common, but it does happen. Another thing is what we call NASH, N-A-S-H, which is basically just a fatty liver, and that's just somebody can have it if they're obese or they have a high fat intake in their diet. Okay. The next thing I'll be going over, now that we've touched on a little bit of what it is and the different causes, I'll be focusing on the treatment here. So I think that the best treatment is just you don't need to focus on a diet or certain medications or think of the word diet. Think of a lifestyle change. When people hear diet, oh my gosh, it's like it becomes a chore or something that's terrible. But if you think of it as a lifestyle change, it's something that you're doing for yourself or your family or your kids or your spouse. So obviously you want to stay healthy. You want to eat healthy, eat fresh fruits and vegetables, avoid salt. People with cirrhosis have to automatically go on a low salt diet because if you eat salt, water follows salt, so then you're going to become more edemic and your belly is going to feel more what we call ascites, which is fluid in the stomach. And you have to go to the doctors and get what we call paracentesis to drain the fluid, because they'll get to the point to where you can't breathe because there's so much fluid inside the abdomen. It puts pressure there on your diaphragm and it makes it difficult to breathe. So cirrhosis can lead to so many more different things, just not having a liver that looks like this. So lifestyle change, eat healthy, fresh fruits, exercise every single day. That's really healthy to actually, even if it's for 20 minutes a day, if you have to break it up into 10 minutes in the morning and 10 minutes at night, whether it's taking a light jog to your mailbox or, going for a walk even after dinner, go to Target or Walmart and take a walk every night after dinner. You'll be surprised by how much of a difference that one little thing makes. Back to the number one cause of liver cirrhosis is alcohol. So don't drink any alcohol. What's the point of it really? Do you want a liver that looks like this again? Nice and soft? Or do you want a liver like this? And I mean, what is the point of it? Just to feel good for a little bit of a moment? If you crave for that pina colada and that nice coconut flavor, then you should just maybe ask for a virgin one. That would be a lot better. Then you could avoid the alcohol. So at least you're cutting that craving by having the virgin pina colada, but then you're still getting what your body is asking for. Same thing with like if you want a strawberry daiquiri. What kind of person are they? Even have beer now, non-alcoholic beer, called a Duels, I believe it's called, and it tastes like regular beer. I've never personally tried it, but that's what people tell me, without the alcohol. So there are different alternatives, and it is well worth having a liver that looks like this compared to a cirrhotic liver, and then to go through all the side effects of having to get your ascites, the fluid, your belly drained, what I tell my patients, uncomfortable, then taking all these medications to try to decrease your side effects or to help the liver not progress so much, and then lastly having to have a liver transplant. That's the last thing you want to have, a liver transplant. That goes into a whole nother topic for a whole nother day of talking, but maybe one day I'll talk about that as well. So, to conclude everything, cirrhosis can be a very deadly disease. If it gets recognized early enough, or if it's diagnosed early on, it can be treated, but most of all it can be prevented. Again, with that lifestyle change, it's not that difficult. Exercise, eat healthy, it's okay. You can have that cake or that candy once in a while, that's fine, but if you live a nice healthy life, no alcohol, eat healthy and well, your liver will not become cirrhotic. Again, there are those few little chances where if you have a hereditary or a genetic disease, and those are unavoidable, but still those are very, very rare. It really depends on you. I hope you really enjoyed this speech. I hope it'll help you in your future careers, and I thank you very much. I hope you all have a wonderful night.